Hi friends, I'm Dr. Toishi Sharma and today we are going to talk about a very critical topic. What happens if you stop your blood thinner? Are you thinking about stopping your blood thinner? Please listen to this first. As a cardiologist, I see the consequences every week. Let's first ask ourselves, when we say blood thinner, what are we talking about? These could be two separate classes of medications. The first is antiplatelet drugs, which basically inhibit the platelet cells in your body and reduce the clotting capacity. These are aspirin, clopidogrel, prasugrel, or ticagrelor. The second class is the anticoagulants. These are called apixaban, rivaroxaban, dabigatran, warfarin, or heparin. So friends, these medications actually don't thin the blood, but they reduce the clotting capacity, meaning if there is a cut or an injury, you will be more prone for bleeding. Stopping these medications suddenly can be dangerous and sometimes it can also be life-threatening. Let's talk about the risks of stopping your blood thinner without advice. Risk number 1 is stroke. Friends, if you have been prescribed a blood thinner for atrial fibrillation and you stop your blood thinner, the irregular heart rhythm lets the blood pool in the heart, and this can form a clot. If the clot travels to your brain, this can result in a stroke. That's why your cardiologist has calculated a CHA2DS2-VASc score to find your risk of stroke and has then prescribed you a blood thinner medication to prevent stroke for you. Risk number 2, stent clotting or stent thrombosis. If you had a heart stent placed and you stop your antiplatelet, a clot can form inside the stent. The artery suddenly gets clogged and this can cause a massive heart attack. This is very dangerous and the massive heart attack can prove to be life-threatening as well. Number 3, deep vein thrombosis and pulmonary embolism. If you have had a DVT in your legs or a pulmonary embolism in your lungs and you stop your blood thinner too early without advice, this clot can grow again. If it's in your legs, it can travel to your lungs, and this can cause sudden chest pain, shortness of breath, or even collapse. This is a medical emergency. Number 4, mechanical heart valves. If you have a mechanical mitral valve or aortic valve and you have been prescribed a blood thinner, it is very important because this blood thinner prevents the formation of clots on the valve. If there is no blood thinner, a clot will form on the heart, which can cause your new valve to malfunction. When this clot forms, the malfunction of the valve causes what we call heart failure. And secondly, if this clot on the valve travels to your brain from the heart, it can cause an acute stroke and leave you paralyzed. Therefore, patients with mechanical heart valve need lifelong anticoagulation and they cannot stop it. Number 5, if you have had a coronary artery bypass surgery, usually for the first 1 year, we recommend 2 antiplatelet medications, and the rest of your life, you should always be taking a baby aspirin. This is to ensure that we give you the best chance of keeping your bypass grafts open. And also remember that the bypass grafts are still dependent on your own arteries to ultimately supply the blood to the heart. Therefore, if you stop the blood thinners or the antiplatelets, then either the bypass grafts can get clogged up or your own arteries can get clogged up. And both of these will create a very difficult situation for you because you have already had bypass and you cannot afford to lose those precious grafts because your options will be very limited after that. Now, some patients tell me, but doctor, I am having bruising or I am having nosebleeds. Now, bruising or small bleeds do not automatically mean you should stop your blood thinner. There are a few things we can consider. Number 1 is that if you are on a blood thinner like Coumadin, we can try to adjust your dose and make sure your INR is not supratherapeutic. Number 2, we can try to switch your blood thinners in some cases because for some people, sometimes an alternative blood thinner works better and causes less bruising than the other. Number 3, we may need to check your kidney function. If the kidney is damaged, it may cause reduced clearance of the medication and may cause more bruising. Number 5, some lab tests to make sure your liver is okay as well will also be helpful. However, unfortunately, sometimes we have to take the side effect of mild bruising or small nosebleeds if we have tried everything, because as you just understood, the risks of stopping a blood thinner can be life-threatening. Now let's talk about when is it actually okay to stop. Sometimes we do stop blood thinners, but we plan it very cautiously. For example, if you are having a high-risk surgery where you are going to be at a high risk for bleeding, then in that case, we look at your individual profile and we say your surgical risk might be too high for bleeding. So we will hold this blood thinner for these few days because your bleeding risk is higher than your clotting risk. Now, when we hold the blood thinner, you are still at a risk of clot formation. But we just say that the risk of bleeding may be higher than the risk of clotting. That's why we stop it and we ask the surgeon to resume it as soon as possible from a surgical standpoint. Number 2, in some people, bleeding risk becomes much higher than the benefit of blood thinners. For example, if someone has frequent falls, if they have neuropathy, they have had fractures because of falls, they cannot maintain their balance, and we feel that this person is going to fall anytime, they may get a head bleed because of the blood thinners. Then we have a discussion with the patient and let them know that your bleeding risk is very high. You also have a clotting risk, but to weigh the risk and benefit, it seems like we may need to hold off on the blood thinner and just accept the risk of clotting. We also use some scales like the CHADS-VASc score or the bleeding risk score to help make this decision. And sometimes we stop the blood thinner when the original reason for the treatment has resolved. For example, if someone has a stent placed in a heart attack, we usually recommend 2 blood thinners for 1 year. And after 1 year, we stop one of the blood thinners because we feel that the body has internalized this stent and they only need 1 blood thinner going forward. Number 2, if someone has a clot in their lungs for the first time, they don't have a recurrent history, we may stop the blood thinner after 6 months with close monitoring. So the decision to start and stop a blood thinner is very complex. It's based on the diagnosis, on the risk factors of the patient, and the overall functional capacity. Stopping it on your own can be life-threatening. So please talk to your cardiologist before you make that decision. And remember, blood thinners prevent clots. Clots can cause strokes, heart attacks, pulmonary embolism. And if you stop your blood thinner, you are removing that protection. Do not stop without medical advice. Thank you.